My name is Kathleen Moorman, and I'm the Corporate Vice President of Real Estate at Baptist Health. So my role here at Baptist is I'm their broker, their real estate broker. Baptist has their own real estate company, which is BHE Real Estate and Development, and we're a full-service real estate company. And so that's broken up into, we have a transaction team, and we have property managers, property accountants, we have engineers, and we have property accountants and security officers. And the unique thing is we also have a safety officer and a support team for him. And what makes that unique is the environment of care. So healthcare is very regulated, and we're part of that team. And it is very focused on the safety and security of patients and their guests, and of course the staff. The challenges are, as all brokers, is finding the right location. And you know, out there in the community, when they hear about an area that we're looking, you know, a lot of people bring that information to us. But one thing that we have to focus on is think about safety and security. Yeah. And so what is important is that we're located in a community area where there's well lit, a lot of traffic, you know, families come by themselves maybe in the evening, we're open late, and those things have to be taken into account. Parking is a huge, very, very important to us. Yeah. And really security and safety for our staff and also for our patients. Yeah. Probably three challenges is one, you know, the local community, understanding the service that's going in. And so when we approach a developer, a landlord, our challenge is they have preconceived ideas of what our services are. And so that's a little bit of a challenge. So they don't want to have something that is very active in their area. And we have to, you know, educate them that they know that it's more like a physician office. It will be very professional, it'll be quiet. And what's important that we look for is that our guests and patients, while they're there visiting, there's other amenities, because that makes that healthcare experience much better. So we look at strategies of areas where we can bring healthcare into the community. So our urgent cares are supported by our hospitals, and since the ERs are, you know, very busy, we try to put in, let's say, a primary care, an urgent care, or an express care close to the neighborhood where that hospital is, so the patients that don't have critical needs can go there. And we extend those hours so that we can work around, you know, people's hours of work, school, and so forth. And we're open on the weekends. Yeah. We have some areas that we're looking up in Broward County. So that is around, I would say, Plantation, 595. We're looking west, like I-75. Some other areas in Dade County is, you know, our West Kendall Hospital is very active. And to support them, we're looking in that area, a little bit south of the hospital and a little bit north, but it's in that west corridor. We definitely like to buy, and we like to develop. And we have, you know, very strict standards. Not only that it's a healthcare company, but we also look to our facilities as to protect our patients and our guests and our employees if any weather conditions come up or so forth. On the other side of the coin, when we build, we like to look at things so that we can reposition it, so we can be nimble, because healthcare is changing quite a bit. You know, there's one thing when I hire staff, and we hire people that have worked in commercial real estate. But what makes it different is when you go to an office building, you go to a shopping center, it's usually something that you are either going to work or you're going to for entertainment or enjoyment. Anybody that comes to our sites are not feeling well, or they bring family and guests that are concerned for that patient. And so we need to be very compassionate and very careful about everything we design, we plan, and how we meet you and greet you and get you into the building and get you out. All of these things have to be taken into account. So we have medical office buildings on our hospital campuses, and the purpose for the design and the development of those buildings is we have physicians that are close to the hospital. You know the traffic in Miami, it's challenging. So if you can put the surgeons and those individuals close to the patients, they can walk back and forth. At the same time, you have a very large patient load that's coming in, and I was standing in the lobby area waiting to go to a meeting, and you're looking at your patients coming in, and you can tell that they're suffering and they're struggling. You know, there were a number of them that you could tell are going through chemo and cancer, and so we try to arrange everything so that wheelchairs, walkers are on flooring that's not slippery, that we have extra wide elevators, extra wide doors. We try to not have you have to push the door open, everything is automatic. And so those things are taken into account. We look at patient flow. With the changes in healthcare, we are going to have more demand and more traffic in our buildings. And so we need to, when we're designing, we need to take those things into account. One is there's a lot of development going down with Brickell and downtown, and along with, you know, the area where they're bringing in the trains and so forth. And so with that density, there is opportunity to bring in more community health. Certainly areas where you can either go by Uber, you can take transit, and you can walk into a physician office, primary care, and express care, and get quick health care. And I think that's something that I'm seeing, and there's an opportunity to bring that health care. Then once that patient is diagnosed, then, you know, if it's needed, then they would be moved into a hospital.